Chapter 18, the Endocrine System. Exercise 18.1. Complete a table with the words from A, B, and C opposite and list forms. Put out a stretch mark in front of the stretched syllable in each word. The first one has been done for you. Verb noun. Inhibit, innovation. Produce, production. Release, release. Replace, replacement. Secret, secretion. Stimulate, stimulation. Exercise 18.2. Complete the pages from a textbook using the illustration and your own knowledge. Look at the B opposite to help you. Pools of GnRH, gonadotropin releasing hormone, are released from the hypothalamus and stimulate LH and FSH released from the pituitary. LH stimulates testosterone secretion from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulates the Sertoli cells in the seminiferous tubules to produce mature sperm, and they inhibit A and B. Inhibiting causes feedback on the pituitary to the decreased FSH secretion. Exercise 18.3. Complete the sentences. Look at A and C opposite to help you. Number 1. A diffuse change after many parts of an organ or gland. Number 2. Allocated change after only one part. Number 3. His diet is deficient in iron. He doesn't get enough iron. Number 4. Excess T3 and T4 increase to basal metabolic rate. Exercise 8.4 marks Ms. Davis' symptoms with the question her doctor asked. Look at the opposite to help you. Number 1, diarrhea. The diarrhea is the letter D. Are your bowels normal? Number 2, eating more is the letter C. What is your appetite like? Number 3, heat intolerance. Letter A. Do you prefer hot weather or cold? Do you prefer hot weather or cold? Number 4. Overactivity. Letter E. Are you able to sit and relax? Number 5. Palpitations. Letter G. Have you ever felt your heart beating rapidly or irregularly? Number 6. Weight loss. Letter B. Is your weight state? Letter 7. Tremor. Is letter F. Do your hands shake? Chapter 19. The eye. Exercise 19.1. Complete a table with words from B opposite and released forms. Verb noun adjective. Accommodate, accommodation. Constrict, constriction, constrict, constricted. Converge, convergence. Dilate, dilation, dilatation. Dilated. Drop, dropping. Oscillate, oscillation. React, reaction. Exercise 19.2 marks the pictures with the conditions. And look at B opposite to help you. Letter A, dropping of lids, number 6. Letter B, dilate pupils, number 3. Letter C, irregular pupil, number 2. Letter D, cataract, number 5. Letter E, squinting, number 1. And letter A, constricted pupils, number 4. Exercise 19.3. Complete the extract from a textbook. Look at C opposite to help you. Retinoscopy. Examine the retina with an ophthalmoscope, if possible with the pupil dilated to obtain the maximum view. Look for papilledema and from flame-shaped hemorrhages and cottonwood exudates. Assess the state of the arteries and note the presence of any narrowing, as well as nipping and arterial veins crossing. Chapter 20, the gastrointestinal system. Exercise 20.1. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed and thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 minutes. Blood pressure 110. 80 millimeters of mercury. Examination of the rest of the cardiovascular and respiratory systems was normal. The abdomen was not distended. There was a generalized tenderness, tenderness which was most marked in the right lower quadrant and was associated with guarding but not rigidity. There was no rebound tenderness and no masses were felt. Vowel sounds were reduced. Exercise 20.2. Mark the description of the stools with the conditions most likely to cause them using your medical knowledge. Look at B opposite to help you. Type of stools, conditions. Number 1, loose bloody is letter C, ulcerative colitis. Ulcerative colitis. Number 2, loose, play, bulky is letter E, celiac disease. Number 3, clay colored is letter F, obstructive jaundice. Number 4, black tarry. Letter A, gastric ulcer. Number 5, small heart. Letter B, irritable bowel syndrome. Irritable bowel syndrome. Number 6, clear, watery with mucus. Letter D, cholera. Exercise 20.3. Match the features to the doctor's questions. Look at B opposite to help you. Number 1, blood. Letter F. Have you passed black stools? Number 2, bowel habit. Letter A. How often do you open your bowels? Number 3. Change in bowel habit. Number Letter B. Are you going to the toilet more often than normal? Number 4. Bulk. Letter G. Is the size of the amount of the stools normal? Number 5. Color. Letter E. What about the appearance of the stools? Number 6. Consistency. Number Letter C. Letter C are the motions hard or loose. Number 7. Offensiveness. Letter D. The Do the motions have an unusual smell? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. The abdomen can be divided into 4 quadrants. Chapter 21 Gynecology. Exercise 21.1. Write a simple English phrase for each for the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy, removal of the womb. Number 2, menorrhagia, heavy period. Number 3, salpingitis, inflammation of one of the tubes, the neck of the ovary to the womb. Number 4, cervical biopsy, biopsy of produced procedure to remove tissues from the cervix and test them for normal conditions. Exercise 21.2. Read the conversation between the gynecologist and the patient. See opposite. And complete the notes about the patient. Menarche, 12 years. Menstrual cycle, 4 or 5 days. LMP, 2/52. Menorrhagia, no. Dysmenorrhea, no. Discharge, a liter of color white. Exercise 21.3. Now write the questions that the doctor asked. Look at C opposite to help you. Menarche, how old were you when you start to get them? Menstrual cycle, how long do the periods last usually? LMP, when was your last period? Menorrhagia, would you say they mer- would you say they are light or heavy? Dysmenorrhea, do you get period pains? Discharge, is there any discharge between periods? Exercise 21.4. Complete a case report. One word is needed twice. Look at B and C opposite to help you. Case 15. A 45-year-old woman had been having prolonged periods lasting for 8 days, with the patches closed, for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously when a copper coil was fitted. She had she had had a normal pregnancy when she was 20 5.